Welcome to Drona Institute of Ayurvedic Studies Ayurvijnana series, a series of Ayush-related general knowledge questions. Question number 101. Which of the following institute under Ayush is designated as the Institute of National Importance? Option A, Institute of Teaching and Research in Ayurveda, ITRA. Option B, National Institute of Ayurveda, NIA. Option C, All India Institute of Ayurveda, AIIA. Option D, Central Council for Research in Ayurvedic Sciences, CCRAS. The correct answer is Institute of Teaching and Research in Ayurveda, ITRA. ITRA is Institute of Teaching and Research in Ayurveda. It is the first institute of national importance in the sector of Ayush. The Parliament of India passed the Institute of Teaching and Research in Ayurveda Act 2020, and the provisions of this act came into force on 15th October 2020. ITRA is formed by the amalgamation of three different institutes, namely the Institute of Postgraduate Teaching and Research in Ayurveda, IPGT and RA, Sri Gulabkund Varma Ayurveda Mahavidyalaya, Jamnagar, and the Indian Institute of Ayurvedic Pharmaceutical Sciences, Jamnagar. The Maharshi Patanjali Institute for Yoga, Naturopathy, Education and Research, MPIYNER, a constituent SFI college of the Gujarat Ayurveda University, Jamnagar, is also integrated with ITRA under the Department of Swastavrita. And regarding IPGTRA and Gulabkund Garhwa, on 1st July 1946, a college for Ayurvedic studies was established by Sri Gulabkund Varma Ayurvedic Society and was named Sri Gulabkund Varma Ayurveda Mahavidyalaya, and the first principal of the college was Vaidya Yadavji Trigamji. Central Institute for Research in Indigenous System of Medicine, CIRISM, started at Dhanvantari Mandir, Jamnagar in 1952, and on 20 July 1956, a central postgraduate center named Center for PG Studies and Research in Ayurveda was started, and in the year 1962, both these centers were merged to form Institute for Ayurveda Studies and Research, IASR. And in 1967, the postgraduate center became an integral part of Gujarat Ayurveda University, Jamnagar, and was renamed as Institute for Postgraduate Teaching and Research in Ayurveda, IPGT and RA, Jamnagar. And the Indian Institute of Ayurvedic Pharmaceutical Sciences, IIAPS, came into existence on 1st August 1999 as a constituent institute of Gujarat Ayurveda University, Jamnagar, and it is the first institute offering education in Ayurveda pharmacy at the diploma and bachelor levels. And Maharshi Patanjali Institute for Yoga, Naturopathy, Education and Research was established in the year 2000 as a full-fledged independent self-financed institute of Gujarat Ayurveda University, Jamnagar. It is now a part of Swastavrita Department of ITRA, Jamnagar. Question number 102. CCRA's launched Smart 4 program on the topic. Option A, Dinacharya. Option B, Ridushodhana. Option C, Sadvrata. Option D, Ayurveda Ahara. The correct answer is option B, Ridushodhana. SMART is Scope for Mainstreaming Ayurveda Research among Teaching Professionals, and it is a flagship initiative by Central Council for Research in Ayurvedic Sciences, and it empowers Ayurvedic faculty to engage in research. And the topic of SMART 4 is Ridushodhana, a preventive care program for longevity and holistic health. This program will be implemented and coordinated through the peripheral research institutes functioning under CCRAs in collaboration with reputed academic institutions across India. And the submission of expression of interest for CCRA Smart 4, the last date is 5th July 2025. The eligibility is for NCISM recognized Ayurvedic institutions. And the topic is Ridushodhana, which is a CCRA's initiative for preventive care. Kale Shuddhi Ayurvriddhi, which is Ridushodhana for longevity of life. Question number 103. Which of the following institute was conferred with deemed to be university status under de novo category? Option A, Institute of Teaching and Research in Ayurveda, Jamnagar. Option B, National Institute of Ayurveda, Jaipur. Option C, All India Institute of Ayurveda, New Delhi. Option D, Central Council for Research in Ayurvedic Sciences, New Delhi. The correct answer is National Institute of Ayurveda, Jaipur. The National Institute of Ayurveda, NIA, deemed to be university de novo category, is an apex autonomous institute under the aegis of Ministry of Ayush, Government of India. It was conferred the deemed to be university status under de novo category and was dedicated to the nation by Prime Minister of India, Sri Narendra Modi, on 13 November 2020. National Institute of Ayurveda is the first central government funded institute to be declared as deemed to be university in the field of Ayush. An independent Ayurveda college was established in 1946 August by the government of Rajasthan in the name Government Ayurveda College, and the college was merged to form National Institute of Ayurveda, known as NIA, in Ayurveda fraternity on 7th February 1976. The NIA is now offering undergraduate, postgraduate, and PhD courses, diploma course in Ayush nursing and pharmacy, and certificate courses. Question number 104. As per the MOU signed in 2022 between two ministries under Government of India, Ayurveda centers are functional at cantonment hospitals and military hospitals in India. The ministries are option A, Ministry of Health and Ministry of Defense, option B, Ministry of Ayush and Ministry of External Affairs, option C, Ministry of Ayush and Ministry of Defense, option D, Ministry of Health and Ministry of Ayush. The correct answer is option C, Ministry of Ayush and Ministry of Defense. Two MOUs were signed between Ministry of Defense with Ministry of Ayush during Global Ayush Investment and Innovation Summit organized at Mahatma Mandir, Gandhinagar, Gujarat from 20 to 22nd April 2022. And one is for starting Ayurveda centers at 37 cantonment hospitals, and second for starting Ayurveda centers at 12 military hospitals of Armed Forces Medical Services, AFMS. And the MOUs were signed by then Special Secretary, Ministry of Ayush, Sri Pramod Kumar Pathak, Director General Armed Force Medical Service, Vice Admiral Rajat Datta, and Additional Director General Defense Estates, Srimati Sonam Yangdol. And well-established and time-tested therapies of Ayurveda are available to residents of cantonments, including families of armed forces personnel and civilians, depending on these Ayurveda hospitals in defense. Thank you. Question number 105. The commemorative postal stamp dedicated to 11th International Day of Yoga was released by option A, Srimati Draupadi Murmu, option B, Sri Narendra Modi, option C, Sri Pratap Rao Jadhav, option D, Sri Rajesh Kotecha. The correct answer is option B, Sri Narendra Modi. Indian Prime Minister Sri Narendra Modi released a special commemorative postal stamp dedicated to the 11th International Day of Yoga to honor a decade of global yoga celebration. And this vibrant design reflects India's timeless message of health, harmony, and holistic living through yoga. And this is the commemorative stamp released by Prime Minister Narendra Modi during International Day of Yoga 2025. And it is celebrating 11 glorious years of yoga's global journey. Question number 106. The components of Ayurvijnana scheme includes option A, capacity building and continuing medical education in Ayush. Option B, research and innovation in Ayush. Option C, Ayurveda biology integrated health research. Option D, all the above. The correct answer is option D, all the above. Ministry of Ayush has Ayurvijnana scheme to support education, research and innovation in Ayush by providing academic activities, training and capacity building. Ayurvijnana scheme have three separate components for the promotion of Ayush education and research. And they are capacity building and continuing medical education, CME in Ayush. Second one is research and innovation in Ayush. And third one is Ayurveda biology integrated health research, ABIHR. Question number 107. Who was the first minister of Ayush of independent India? Option A, Sri Mahendra Munjapara. Option B, Sri Sarbananda Sonowal. Option C, Sri Sripad Ashok Naik. Option D, Sri Pratap Rao Ganapat Rao Jadhav. The correct answer is option C, Sri Sripad Ashok Naik. Sri Sripad Ashok Naik was the first Minister of Ayush of independent India. He has held the position of Union Minister of State Independent Charge in the Ministry of Ayush since November 2014 to 2021. And these are the different ministers of Ayush. Sri Sripad Ashok Naik from 9th November 2014 to 7th July 2021. Sri Kiran Riju is having additional charge from 19 January 2021 to 7 July 2021 due to the hospitalization of Sri Sripad Ashok Naik. And Sri Sarbananda Sonowal is the cabinet minister from 7 July 2021 to 10 June 2024. Sri Mahendra Munjapara is having the Ministry of Ayush as the Minister of State from 7th July 2021 to 10th June 2024 during the turn of Sarbananda Sonowal, and Sri Prataprao Ganapatrao Jadhav is having Minister of State of Independent charge from 10th June 2024 till now. Question number 108. Nikshay Mitra is related with option A, AIDS, option B, tuberculosis, option C, COVID-19, option D, Nipah. The correct answer is option B, tuberculosis. Ministry of Health and Family Welfare, Government of India is implementing the community support to TB patients, Pradhan Mantri TB Mukt Bharat Abhiyan, for the effective engagement of the community in the path towards ending TB in India. And Pradhan Mantri TB Mukt Bharat Abhiyan aims to ensure linkage of all TB patients on treatment with a Nikshay Mitra for providing community support. And Nikshay Mitra are donors for this program, and they include cooperative societies, corporates, elected representatives, individuals, institutions, non-governmental organizations, political parties, and partners. Nikshay Mitra shall provide additional support to all the on-treatment TB patients who have given consent for support in the selected health facilities, blocks, urban wards, districts, states for accelerating response against tuberculosis to complement government efforts. An individual Nikshay Mitra can choose a health facility, and other Nikshay Mitras have to choose the entire geographical units such as blocks, urban wards, districts, and states. And the type of additional support provided by Nikshay Mitra are nutritional support, additional investigations for the diagnosed TB patients, vocational support, additional nutritional supplement. And the minimum period of commitment for additional support by Nikshay Mitra is 6 months. The support provided to the patient under this initiative is in addition to the free diagnostics, free drugs, and Nikshay Poshan Yojana provided by National TB Elimination Program to all TB patients. Question number 109. Which of the following is not a component of Ayush Swasthya Yojana? Option A, Ayush and Public Health. Option B, Ayush for Sports Medicine. Option C, Ayurveda Biology Integrated Health Research. Option D, upgradation of facilities to Center of Excellence. The correct answer is option C, Ayurveda Biology Integrated Health Research. Ayush Swasthya Yojana Central Sector Scheme of Ministry of Ayush has 3 components, and they are 1, Ayush and Public Health, second one is Ayush for Sports Medicine, and third one is upgradation of facilities to Center of Excellence. And the Public Health Intervention PHI scheme is being implemented since 11th 5-year plan, that is from 2007-8. Government of India has also decided to identify reputed institutions engaged in Ayush education, drug development and research, clinical research in government or non-government sector, and to support them to upgrade their functions and facilities to levels of excellence under the scheme Center of Excellence. Question number 110. The Department of Integrative Medicine was established in NIMHANS on option A 2019, option B 2020, option C 2022, option D 2014. The correct answer is option A 2019. The National Institute of Mental Health and Neurosciences, NIMHANS, is situated at Bengaluru, India, and it is a pioneer institute for psychiatric and neurological services in India. The Department of Integrative Medicine was established in October 2019 by incorporating the Center of Integrative Medicine and Research, CIMER, at NIMHANS. In January 2020, the NIMHANS Integrated Center for Yoga, NICY, was also brought under the department. The Department of Integrative Medicine is one of first of its kind department in an institute of national importance in India, which integrates traditional Indian knowledge from Ayurveda and Yoga with modern medical science in providing clinical services, academic training, and research activities with a special focus on mental health and neurosciences. And the history, the Advanced Center for Yoga, Mental Health and Neurosciences was established at NIMHANS in November 2007 in collaboration with Morarji Desai National Institute of Yoga, New Delhi. And this center was dedicated to yoga promotion, training, research, and health service for patients. And the NIMHANS Integrated Center for Yoga, NICY, was established to provide quality yoga training to patients, to develop generic yoga modules for neuropsychiatric disorders, mainstream yoga as a part of modern medical practice, and lead the way in scientific research into the effects of yoga in neuropsychiatric disorders. Question number 111. Which of the following institute is designated as WHO Collaborating Center for Traditional Medicines, Ayurveda? Option A, Institute of Teaching and Research in Ayurveda. Option B, National Institute of Ayurveda. Option C, All India Institute of Ayurveda. Option D, Central Council for Research in Ayurvedic Sciences. The correct answer is option A, Institute for Teaching and Research in Ayurveda. The Institute of Teaching and Research in Ayurveda, ITRA Jamnagar, is the first institute of national importance in the sector of Ayush. It is formed by the amalgamation of three different institutes, namely Institute of Postgraduate Teaching and Research in Ayurveda, Sri Gulabkund Varma Ayurveda Mahavidyalaya, Indian Institute of Ayurvedic Pharmaceutical Sciences, Jamnagar. The institute is designated as WHO Collaborating Center for Traditional Medicines Ayurveda, and it is the first premier teaching and research center for Ayurveda in India. And it is a pioneer in the Ayurveda field to introduce MPharm Ayurveda, MSc medicinal plans, PhD degree courses, and short-term regular Ayurvedic courses for foreigners. And ITR is regularly publishing peer-reviewed quarterly journal Ayu since 1964. Question number 112. The National Telemedicine Service of India is option A, e-Aushadhi, option B, e-Sanjeevani, option C, e-Charak, option D, e-Vidwan. The correct answer is option B, e-Sanjeevani. E-Sanjeevani is the National Telemedicine Service of India. It is launched by Ministry of Health and Family Welfare, Government of India. The Digital Health Innovations Group at Center for Development of Advanced Computing, CDAC, Mohali, India, is the implementing agency for design, deployment, and maintenance of e-Sanjeevani. And it is launched to tackle shortage of doctors, especially specialists, to reduce the overburden of district and tertiary hospitals, health record creation at primary and secondary levels, and need for a continuum of care. E-Sanjeevani brings quality healthcare to the doorstep of every Indian, ensuring easy, equitable, and timely access to medical consultations. Question number 113. Ayush Information Hub is designed and developed by option A, Central Council for Research in Ayurvedic Sciences, option B, Digital India Corporation, option C, Center for Development of Advanced Computing, option D, Bhaskaracharya National Institute for Space Applications and Geoinformatics. The correct answer is option B, Digital India Corporation. Ayush Information Hub is a hub which is set up to disseminate all authentic and verified information related to Ayush with Ministry of Ayush and organizations under the ministry. And it is designed and developed by Digital India Corporation and is accessible through Info Hub at ayush.government.in. Ayush Information Hub facilitates public to access the information without login, and internal users such as officials and organizations under the ministry will require login through credentials for accessing information related with internal users. And in Ayush Information Hub, there are details regarding Ayurveda, Yoga, Naturopathy, Unani Medicine, Siddha, Sovaripa, Homeopathy, and autonomous body information under the Ministry of Ayush. There are categories such as technical data, education policy, drug policy, NMPB, schemes, admin, legal, finance, events, notification, new developments, digital Ayush, annual reports, and statistical publications in the Ayush Information Hub. Question number 114. The comprehensive glossary of Ayurvedic terminology mentioned in Ayush Soft is option A, Shabda Taravini, option B, Shabda Nidhi, option C, Shabda Kosha, option D, Ayurvijnana. The correct answer is option B, Shabda Nidhi. Ayush Soft is a platform that combines ancient Ayurvedic wisdom with modern accessibility. Ayush Soft connects the ancient and contemporary, offering knowledge for seekers and practitioners. And it offers an encyclopedia and a glossary providing a holistic journey into Ayurveda. And Ayurvijnana is the Ayurveda encyclopedia, which is mentioned in Ayusoft with search facility offering online Samhita articles, therapeutic procedures, video clips, photo gallery, and audio mantra files. And Shabdanidhi is the comprehensive glossary of Ayurvedic terminology detailing its meanings, origins, definitions, and clinical applications. Question number 115. The distinct layers of Ayush grid are option A, core layer, option B, national layer, option C, citizen assist, option D, all the above. The correct answer is option D, all the above. Ayush Grid is an Ayush-centric digital health platform created by Ministry of Ayush, Government of India in the year 2018. It works in synchronization with the Ayushman Bharat Digital Mission, India's national digital health infrastructure platform. The components of Ayush Grid cover all the verticals of Ayush sector, namely health services, education, Ayush research, central sector, and centrally sponsored schemes, training programs, citizen-centric services, drug licensing portal, and media outreach. Ayush Grid has four distinct layers, and they are core layer, national layer, state layer, and citizen access. And there are 22 digital incorporations or initiatives integrated into a secure, interoperable digital ecosystem. And they include Namaste Portal, Ayush Research Portal, Ayush Next, Ayush NGO Portal, Ayush Soft and Ayurveda eBooks, Ayush Information Hub, Ayushman Bharat Health Account enabled Ayush Hospital Information Management System, eSanjeevani Telemedicine Service, Ayush Sanjeevani Mobile App, M Yoga App, Namaste Yoga App, Vibrake App, Global Information System for Ayush, e-Office Implementation, TKDL, Sahi Portal, Amar Portal, e-Charak, e-Aushadhi, Scientifically Validated Prakriti Analysis Tool, Ayurgenomics, Online Counseling System for Ayush UG and PG admissions, and use of bioinformatics, chemi-informatics, and genomics, and CRM tools in accelerating drug discovery, and topic group for the use of artificial intelligence in traditional medicine, artificial intelligence for health, AI for Health initiative by the International Telecommunication Union, ITU, and World Health Organization. The Ministry of Ayush has signed Memorandum of Understanding with Ministry of Electronics and Information Technology for technical help in Ayush Grid project. Question number 116. The digitally powered initiative of Ministry of Ayush that aims to broaden the sphere of information exchange with career guidance, interactive forums, and quizzes, especially for the youth. Option A, Ayush Grid. Option B, Ayush Next. Option C, eSanjeevani. Option D, Ayush Soft. The correct answer is option B, Ayush Next. Ayush Next is a digitally powered initiative of the Ministry of Ayush that aims to broaden the sphere of information exchange with career guidance, interactive forums, and quizzes. It is a platform for the youth to share ideas and knowledge, seek advice and counseling, brainstorming, and keep learning. It has a community of experts to resolve queries based on career advice, employment questions, degrees, and qualifications. And it is for the creation of awareness and interest in AI system among youth, and it is a platform for sharing ideas, brainstorming, and collaborative learning, and it is focusing and leveraging the energy, innovation, and imagination or inventions of youth. And the objective of Ayush Next is leverage the internet and social media for information exchange, motivation to Ayush students in the country to instill a pride on them, focusing and leveraging the energy, innovation, intervention, and imagination of the youth, lead and support activities in Ayush such as research projects, communication campaigns, festivals, and community health initiatives, creation of awareness and interest among youth, and promotion of Ayush research, channelizing the energy, creativity, and enthusiasm of youth to public health. Question number 117. The portal developed by Ministry of Ayush, which facilitate posting of success stories or successfully treated cases by Ayush practitioners. Option A, Ayush Grid. Option B, Ayush Next. Option C, Ayush Clinical Case Repository. Option D, Ayush Soft. The correct answer is option C, Ayush Clinical Case Repository. Ayush Clinical Case Repository, ACCR portal, is developed by the Ministry of Ayush as a platform to support both Ayush practitioners and the public. And this portal will facilitate posting of success stories or successfully treated cases by Ayush practitioners. These cases will help Ayush practitioners to know approaches adopted by their colleagues in treatment of various patients. The Ayush practitioners from all over the world can enroll and share information about successfully treated cases for the benefit of all. And they are required to sign up in their first instance by entering specified details, and they can sign in with credentials and they can submit case on the portal at any time. All submitted cases will be reviewed by the experts, and after their approval will be published and available for public view. The public can go through the cases published on this portal and understand the strength of various Ayush systems in the treatment of various ailments. Former Minister of State in charge for Youth Affairs and Sports and Ayush, Sri Kiran Rijiju, launched the Ayush Clinical Case Repository portal in 2021. Question number 118. Ayush Diksha, a human resource development center of Central Council for Research in Ayurvedic Sciences, is starting at option A, Central Ayurveda Research Institute, New Delhi. Option B, Central Airway Research Institute, Kolkata. Option C, Central Airway Research Institute, Patiala. Option D, Central Airway Research Institute, Bhubaneswar. The correct answer is option D, Central Airway Research Institute, Bhubaneswar. Ayush Diksha is a human resource development center of Central Council for Research in Ayurvedic Sciences, and it is starting in the campus of Central Airway Research Institute, Bhubaneswar. An Ayush Diksha Center will enable the Ayush professionals to turn up their skills and upscale their dexterity in providing world-class patient care services to the people of the country. And the inauguration of and the foundation stone laying ceremony of Ayush Diksha Human Resource Development Center of CCRAS was done by Sri Sarbananda Sonowal, Honorable Union Minister of Ministry of Ayush and Ministry of Ports on 20 January 2024. And this center offers training, skill enhancement, and Ayurveda research programs. It promotes integrated healthcare with modern medicine. Question number 119. Ayush Nivesh Sarthi portal is a joint initiative of Option A, Startup India and Ministry of Ayush. Option B, Invest India and Ministry of Ayush. Option C, Niti Aayog and Ministry of Tourism. Option D, All India Institute of Ayurveda and Ministry of Tourism. The correct answer is option B, Invest India and Ministry of Ayush. Ayush Nivesh Sarthi portal is a first India's dedicated investor portal for traditional medicine and wellness, and it is a joint initiative by Invest India and Ministry of Ayush Government of India, and it serves as a dedicated gateway for international and domestic investors seeking opportunities in India's Ayush sector. It offers comprehensive information on establishing operations in India, including business guidelines, governmental policies, and regulatory frameworks. And the objectives of Ayush Nivesh Sarthi portal are promote investment in India's Ayush sector, provide insights into India's infrastructure assets such as parks, hotspots, and clusters, unlock potential across diverse Ayush subsectors, simplify investor onboarding processes, guide investors through government schemes, policies, and incentives. And Invest India serves as a dedicated investor facilitation cell of the Ministry of Ayush, offering comprehensive support in various areas such as guiding potential investors, providing thorough assistance throughout the investment process, and strategizing policy frameworks and development. Question number 120. The components of Ayushman Bharat Digital Mission (ABDM) includes Option A, Healthcare Professionals Registry and Health Facility Registry. Option B, Unified Health Interface. Option C, Aabha Mobile App and Aabha Number. Option D, all the above. The correct answer is option D, all the above. ABDM is Ayushman Bharat Digital Mission. It is implemented by National Health Authority, an agency of Government of India. And Ayushman Bharat Digital Mission aims to develop the backbone necessary to support the integrated digital health infrastructure of the country. And the components of ABDM are Healthcare Professionals Registry, HPR, Health Facility Registry, HFR, Unified Health Interface, UHI, Aabha Mobile App with PHR, and Aabha Number. And Healthcare Professionals Registry, HPR, is a comprehensive repository of all healthcare professionals involved in delivery of healthcare services across both modern and traditional systems of medicine. Enrolling in the Healthcare Professionals Registry will enable them to get connected to India's digital health ecosystem. And Health Facility Registry, HFR, is a comprehensive repository of health facilities of the nation across different systems of medicine. It includes both public and private health facilities, including hospitals, clinics, diagnostic laboratories, and imaging centers, pharmacies, etc. Enrolling in the Health Facility Registry will enable them to get connected to India's digital health ecosystem. UHI is Unified Health Interface, and it is envisioned as an open protocol for various digital health services. And the UHI network will be an open network of end user applications and participating health service provider applications. It will enable digital health services between patients and health service providers, including appointment booking, teleconsultation, and service discovery. Aabha number is Ayushman Bharat Health Account Number, and it is used for the purposes of uniquely identifying persons, authenticating them, and threading their health records across multiple systems and stakeholders. And Aabha Mobile App with Personal Health Record Personal health record is an electronic record of health-related information of an individual that conforms to nationally recognized interoperability standards and that can be drawn from multiple sources while being managed, shared, and controlled by the individual. And functions that are supported by a personal health record will enable an individual to manage information about his or her healthcare. This includes viewing of a longitudinal record comprising of all health data, lab reports, treatment details, discharge summaries across one or multiple health facilities. Question number 121. Aadhaar number is option A, Aadhaar based health account number, option B, AHMIS based health account number, option C, Augmented Bharat Health Authority number, option D, Ayushman Bharat Health account number. The correct answer is option D, Ayushman Bharat Health account number. ABHA is Ayushman Bharat Health account number. It is a hassle-free method of assessing and sharing one's health records digitally. ABHA number enables one's interaction with participating healthcare providers and allows to receive digital lab reports, prescriptions, and diagnosis seamlessly from verified healthcare professionals and health service providers. ABHA number will be used for the purposes of uniquely identifying persons, authenticating them, threading their health records only with the informed consent of the patient across multiple systems and stakeholders. And ABHA card is a transformative healthcare initiative introduced under Ayushman Bharat scheme. And this digital health ID consists of a unique 14-digit identification number, which is the ABHA number, which aims to streamline access to healthcare services across India. Question number 122. The Secretary of Ministry of Ayush Government of India is option A, Vaidya K.S. Dhiman, option B, Vaidya Rajesh Kotecha, option C, Vaidya Manoj Nesari, option D, Vaidya Tanuja Nesari. The correct answer is option B, Vaidya Rajesh Kotecha. Vaidya Rajesh Kotecha is the Secretary of Ministry of Ayush, Government of India from 2017 to June 2026. And the others are eminent personalities in Ayush, and they are Vaidya K.S. Dhiman is the Vice Chancellor, Sri Krishna Ayush University, Kurukshetra, Haryana. Vaidya Manoj Nesari is the Advisor, Ministry of Ayush, Government of India. Vaidya Tanuja Nesari is the Director, Institute of Teaching and Research in Ayurveda, Jamnagar, Gujarat. Question number 123. Pragati Initiative of Central Council of Research in Ayurvedic Sciences stands for option A, Pharma Research in Ayurveda and Technology Innovation. Option B, Pharmacy-related Ayurveda-assisted technology initiative. Option C, Pharma Research in Ayurvijnana and Techno-Innovation. Option D, Pharmacology, Rasashastra, and Guna Vikalpa Anusandhana Technical Innovation. The correct answer is option C, Pharma Research in Ayurvijnana and Techno-Innovation. Pragati is Pharma Research in Ayurvijnana and Techno-Innovation. It was launched by Central Council for Research in Ayurvedic Sciences, CCRAS, and it's a collaborative initiative by CCRAS to propel Ayurveda research and industry. CCRAS hosted Pragati 2024 at India Habitat Center, New Delhi on 28 May 2024. And this interactive meeting focuses on exploring research opportunities and fostering collaboration between CCRAS and Ayurveda drug industry. The objectives of Pragati are utilize research outcomes and technologies developed by CCRAS, establish robust networks for collaborative research in quality control, drug standardization, product development, and validation, identify potential industrial partners with in-house R&D facilities, explore opportunities for capacity building of researchers in drug manufacturing and product development, assist Ayurveda professionals in initiating startups and incubating centers, promoting entrepreneurship in Ayurvedic pharmaceutics. Question number 124. Which of the following Ayush scheme is a centrally sponsored scheme by Government of India? Option A, Central Sector Scheme for Promotion of International Cooperation in Ayush. Option B, Central Sector Scheme for Information, Education and Communication in Ayush. Option C, Conservation, Development and Sustainable Management of Medicinal Plants. Option D, National Ayush Mission. The correct answer is option D, National Ayush Mission. Central schemes under Government of India are of two categories. First one, central sector schemes and centrally sponsored schemes. The central sector schemes are fully funded and implemented by central government and are formulated from subjects covering under union list. And the central sector schemes are Ayurvijnana, Ayur Swasthya Yojana, Ogosi, Information, Education, Communication in Ayush, promotion of international cooperation in Ayush, conservation, development, and sustainable management of medicinal plants, champion service sector scheme for medical value travel. The centrally sponsored schemes are schemes sponsored by the center, and the financial participation is from central government and from state government also. And National Ayush Mission is a centrally sponsored scheme of Ayush. Question number 125. Organization of Arogya Parv, Arogya Fair and Health Fair is a main component of option A, Central Sector Scheme for Promotion of International Cooperation in Ayush. Option B, Central Sector Scheme for Information, Education and Communication in Ayush. Option C, OGOSI. Option D, Ayurvijnana. The correct answer is option B, Central Sector Scheme for Information, Education and Communication in Ayush. Central schemes under Government of India are of two types, Central Sector Scheme and Centrally Sponsored Scheme. And Central Sector Scheme for Information, Education and Communication in Ayush is a central sector scheme to propagate Ayush systems of healthcare, and it has 9 components. The objective is to create awareness about efficacy and cost effectiveness of Ayush, to disseminate information on research outcomes, to facilitate interaction among stakeholders, to organize events for the promotion and propagation of Ayush system through various communication channels, including digital and audio-visual media. And there are 9 components in this central sector scheme, and they are organization of Arogya fairs at national and state level, organization of Ayurveda Parv and Yoga Fest or Ulsav, participation in health fairs, melas, exhibitions, preparation and distribution of authentic publicity material on Ayush systems, including new media, internet, multimedia, print media, and digital media campaigns, activities and programs undertaken by ministry, its autonomous bodies and Ayush directorates or Ayush societies of states and union territories, providing financial assistance to reputed organizations, Ayush-specific NGOs, educational or research institutes for organizing seminars, webinars, conferences, symposiums, workshops, meeting on Ayush system, providing incentives to Ayush industry to participate in national and state Arogya Fair, melas organized by central or state governments or governmental organizations, conducting webinars, virtual exhibitions, and digital events on Ayush-related topic and participating in them, media campaign through social media and other new media. Question number 126. Establishment of Ayush information cells and Ayush academic chairs in foreign countries is a component of which central sector scheme? Option A, Central Sector Scheme for Promotion of International Cooperation in Ayush. Option B, Central Sector Scheme for Information, Education and Communication in Ayush. Option C, OGOSI. Option D, National Ayush Mission. The correct answer is option A, Central Sector Scheme for Promotion of International Cooperation in Ayush. Central schemes under Government of India are of two types, Central Sector Schemes and Centrally Sponsored Scheme. And Promotion of International Cooperation in Ayush is a central sector scheme which aims to promote and strengthen awareness and interest in Ayush systems of medicine at the international level. And it has 6 components, and the objectives are to facilitate international promotion, development, and recognition of Ayush, fostering interaction among stakeholders, supporting international exchange of experts and information, boosting global trade in Ayush products and services, promoting academics and research through establishment of Ayush academic chairs in foreign countries. And the 6 components are international exchange of experts and officers, incentive to Ayush entrepreneurs and institutions, support for international market development, translation and publication of Ayush literature, establishment of Ayush information cells and health centers or institutions, international fellowship or scholarship program. Question number 127. National Ayush Mission was launched by Government of India on Option A 2011, Option B 2014, Option C 2019, Option D 2020. The correct answer is Option B 2014. Central schemes under Government of India are of 2 categories, Central Sector Schemes and Centrally Sponsored Scheme. And National Ayush Mission is a centrally sponsored scheme. It was launched by Government of India on 15th September 2014 for implementing through states or union territories. And the objectives of National Ayush Mission is to provide Ayush healthcare services throughout the country by strengthening and improving Ayush healthcare services, to establish a holistic wellness model through Ayush health and wellness centers focusing on preventive and promotive healthcare based on Ayush principles and practices to reduce the disease burden and out-of-pocket expenditure, to provide informed choice to the needy public through co-location of Ayush facilities at PHC, CHC, and district hospitals, resulting in medical pluralism, to emphasize the role of Ayush in public health as per National Health Policy 2017, to enhance and strengthen the infrastructure of Ayush educational institutions. And the components of National Ayush Mission are Ayush Services, Ayushman Arogya Mandir, educational institutions, Flexi Pool, and admin cost. And in Ayush Services, there are co-location of Ayush facilities at PHC, CHC, and district hospitals, supply of essential drugs to government Ayush hospitals, government dispensaries, and government or aided teaching institutional Ayush hospitals, upgradation of existing standalone government Ayush hospitals, upgradation of existing government or panchayat or government aided Ayush dispensaries, construction of building for existing Ayush dispensary or establishing a new Ayush dispensary, setting up of 10-bedded or 30-bedded or 50-bedded integrated Ayush hospitals, Ayush public health programs, behavioral change communication, mobility support, Ayush Gram, and school health program through Ayush. Question number 128. Which of the following is included in the 12 service delivery framework of Ayushman Arogya Mandir, AHWC? Option A, neonatal, childhood, and adolescent healthcare services. Option B, reproductive healthcare services. Option C, elderly and palliative healthcare services. Option D, all the above. The correct answer is option D, all the above. Union Cabinet on 20th March 2020 approved the proposal of Ministry of Ayush to start 12,500 health and wellness center under Ayushman Bharat in a phased manner from the year 2019-20 to 2023-24. And the Ayush Health and Wellness Centers, AHWC, would be operationalized through states or union territories in centrally sponsored scheme mode and under the broad umbrella of National Ayush Mission. And the vision is to establish a holistic wellness model to reduce the disease burden, out-of-pocket expenditure, and to provide informed choice to the needy public. Functional integration with existing establishment for providing comprehensive care by using standard protocols. Upgradation of infrastructure. Community mobilization for self-care. Sensitization and capacity building of healthcare providers. Linkages with higher level facilities, Ayush educational institutions, reputed non-governmental offices, and trust. Documentation with the help of information technology platform. And this is the outline. And the services under Ayushman Arogya Mandir, AHWCR, preventive and promotive measures for self-care through healthy lifestyle, food, yoga, and medicinal plans, and management of common ailments under 12 service delivery framework. And these are the 12 service delivery framework: care in pregnancy and childbirth, neonatal and infant healthcare services, childhood and adolescent healthcare services, reproductive healthcare services, management of communicable disease through national health programs, general outpatient care for acute, simple, and minor ailments, screening, prevention, control, and management of non-communicable diseases, care for common ophthalmic and ENT problems, basic oral health care, elderly and palliative healthcare services, emergency medical services, including burns and trauma, screening and basic management of mental health ailments. Question number 129. The chapter Introducing Ayurveda, the Science of Health and Disease is included in which of the following subject by NCERT for class 11 students? Option A, Indian Knowledge Systems. Option B, Knowledge Traditions and Practices of India. Option C, Life Sciences Ayurveda for Life, Health and Well-being. Option D, Ayurveda Biology. The correct answer is option B, Knowledge Traditions and Practices of India. NCERT is National Council of Educational Research and Training, and it is an autonomous organization set up in 1961 by the Government of India to assist and advise the central and state governments on policies and programs for qualitative improvement in school education. And one of the objectives of NCERT is to prepare and publish model textbooks, supplementary material, newsletters, journals, and develops educational kits and multimedia digital materials. And NCERT has published Knowledge, Traditions, and Practices of India Part 1 textbook for class 11 students, and Ayurveda is included as Chapter 7 named Introducing Ayurveda, the Science of Health and Disease. Question number 130. Which of the following institute is designated as Center of Excellence for Development of Ayush Knowledge and Skilled Human Resource for Young Aspirants? COE Dakshya. Option A, National Institute of Ayurveda, Jaipur. Option B, Central Council for Research in Ayurvedic Sciences, New Delhi. Option C, Institute of Teaching and Research in Ayurveda, Jamnagar. Option D, All India Institute of Ayurveda, New Delhi. The correct answer is option D, All India Institute of Ayurveda, New Delhi. All India Institute of Ayurveda, New Delhi is designated as Center of Excellence, COE, for development of Ayush knowledge and skilled human resource for young aspirants, Dakshya. Dakshya signifies skill, expertise, and proficiency in their respective professions. And the All India Institute of Ayurveda, COE Dakshya, collaborates with Ministry of Ayush, Healthcare Sector Skill Council, and Ministry of Rural Development. And the collaboration of All India Institute of Ayurveda with Ministry of Ayush is in Champion Service Sector Scheme for Medical Value Travel. And with Healthcare Sector Skill Council is the certification with National Qualification Register, NQR. And with Ministry of Rural Development is in Deen Dayal Upadhyaya Gramin Kaushal Yojana. Thank you.